OLE Health has been building trust with our community. We've been here for 50 years, and whether it be in our brick-and-mortar clinics or in our mobile health unit, we are bringing our services to the community.
OLE Health was founded here in the Napa Valley about 5 decades ago by a group of farm worker advocates and forward-thinking vintners that saw a need for healthcare for our migrant farm workers.
We want to make sure that we bring trust, that we have those relationships with our community. So with our farm workers, we have our outreach team dedicated to connect with the community. We're bringing our providers as well to ensure that they're meeting face-to-face before they even come into the health clinic.
Our whole mission is about ensuring that absolutely every person has the best quality healthcare. And that means anyone who walks through our doors, regardless of their ability to pay or their insurance status or their immigration status, receives the top quality care.
The mobile health clinic started with bringing in the clinical team to ensure that we brought services to our community, to where they're at, to bring access to care to our communities. And so what we offer is preventative health screenings. We also do education and resource referral to our community members, whether it be internally in our clinics or to our community-based organizations and partners.
I really like to talk about OLE as being really part of the engine that helps keep this wine region, this world-class destination working. And we really take care of our workforce. We're helping make sure that all of those workers are healthy, and more importantly, that their families are healthy.
They're seeing our providers, they're meeting our medical assistants, they're meeting our care team and ensuring that they have care. When my parents didn't have insurance, they came from Michoacan, Mexico, and my parents were still trying to navigate the English, the different barriers that many of our clients and patients face on a day-to-day basis. They had heard about Clínica OLE Health, and that was the trusted source. That is the trusted source. And so we came, and they took care of me. My grandfather, my grandmother still to this day utilize the services at OLE Health. If you ask me what the most rewarding thing is about my job, about our community, it's that it's still here for everyone and anyone that needs these critical services.
We're here in the heart of the Napa Valley in Rutherford at Sullivan Rutherford Estate, and we have the privilege to host Vida OLE, which is a fundraiser for OLE Health, which supports the local community with healthcare services. 1 in 4 adults receive healthcare services from OLE Health, and 1 in 3 children. So it's a very, very important organization to the well-being of our valley and our farm workers. We're so dependent on agricultural workers, so taking it on ourselves to take care of the needs of our unique community is very important.
From the very beginning, this community has been incredibly generous and supportive of OLE Health and helping to shepherd our growth. And we're just so very fortunate to be here in the Napa Valley that has such a spirit of philanthropy that's really woven into the fabric of this community. And we have a need every year of about $10 million that we need to raise through grants and private donations to help pay for and fund those programs that our most vulnerable patients need. It's not lost on us that we're incredibly lucky to have this community support behind us, because not every community health center has this resource, and so we're always just so incredibly grateful for that.